The patients have been absolutely delighted with the service so far. We've only been running it for 3 months, so this is a project that we're doing an evaluation on, so we're going to evaluate it properly. We've got a small grants award from the National Lung Cancer Nurses Forum, so we're going to evaluate this with questionnaires, patient stories, qualitative and quantitative data, because we want to see whether whether the patients like having a nurse to do this role. And I think that they do seem to, because they seem to think that they've got the best of both worlds. They've got the nurse that's going to be very involved in them as a person. You know, I can support them, I can support their family, I can be there at the end of the phone if they need to ring and ask any questions, because they have the continuity of the nurse, the key worker role right from the start, and they know they've got that throughout the pathway. And I give them information at the time, so they've got written information, so they've got all the details really. And I will then write to them as well following the consultation to set out what we've discussed in the consultation, so that they can you know, ask questions once they see it written down. Gosh, what does that mean, you know? So that's the way we're running the clinic. And then of course, once they have had the investigations and they have had all the you know, the investigations or whatever, the tests and things, that all comes back to the multidisciplinary team meeting, and therefore that's discussed, and then I would give them the MDT outcome diagnosis, myself as well, as a follow-up. And then they go off to whatever treatment they might have, but I would continue to follow them. So I'd continue to follow them throughout. So yeah, so it's a new thing, and we're going to assess it and see how it goes, and then come back to BTOG next year to present the findings.